Welcome to the Sit, Stay, Laugh podcast. My name is Dr. Adam Chrisman. I'm a general practitioner, and I'm also the Chief Veterinary Officer for DVM 360, which oversees continuing education for veterinary professionals.
And my name is Dr. Ashley Bourgeois, also known as the Derm Vet. I'm a board-certified veterinary dermatologist, passionate about educating veterinarians and pet owners about pet skin and ear disease. We are two veterinary besties who are intrigued with all things pets.
And we love to have a fun time laughing through life.
Come along with us for a fun ride.
Sit,
stay,
laugh. Hey, everybody. Welcome back to the Sit, Stay, and Laugh podcast. I'm Dr. Adam Chrisman.
Oh, and I'm Dr. Ashley Bourgeois. I love it. I'm very proud of you. You got the name right. It only took us 3 episodes, but you were so natural with that.
Thank you so much. Well, we're very excited. We want to thank our friends from Wedgewood Pharmacy for supporting and sponsoring this great conversation, because we're going to chat a little bit about compounding in a moment. But Ash, who do we have on the show? Who is this guy? I don't even know him.
Listen, Adam, I am so excited because we have, basically a veterinary celebrity here. I mean, usually it's just you that has the celebrity status, but Matt's kind of up there with you. We get to welcome Dr. Matt McGlasson on the podcast today. Cheers.
Yes.
Yeah.
This is great.
Thank you guys so much for having me. Super excited about this.
Oh, thank you. Well, this podcast is going to the cats. So to the cat parents out there, tune in. I mean, look at the shirt Dr. Bourgeois got on.
So everyone listening is going to have to go check out the YouTube channel. I was telling the story behind this shirt. So I do a lot of lecturing that usually is more professional, business casual. I get back from an appointment today. I kick my husband out of the office so I can record this because he's working from home today. And he's like, "Oh, is that what you?" I was like, "Excuse me, this is my podcast with Adam. We're not exactly the most professional people on this podcast." But to tell
That's great.
Yeah, to tell the backstory, first of all, we're talking about cats. This is a cat t-shirt, a cat, lots of colors going on, sunglasses, which makes sense with Matt's content, and it says karma. The story behind this shirt is my daughter, who turned 7 this year, had a Taylor Swift birthday party. I bought her the shirt for her, and then Amazon sent it and accidentally sent an adult size. And then when I went to return it, they said, "We'll just refund you, don't send it back." So I just gained a cool cat shirt. I mean, for free. So why not?
Win-win.
Right? And isn't it fitting, this kind of funky cat shirt? Because, Dr. Matt McGlasson has such amazing content that, first of all, is really educational, but second of all, is hilarious. I mean, you two are probably the funniest people I know in veterinary medicine with some of your content.
No, Matt is definitely hilarious. So wait, tell the viewers and listeners a little bit about, who you are and how you got involved in, I always like to hear everyone's story about vet med, how you became interested in vet med, and then specifically with cats.
Absolutely. So before I started making ridiculous cat videos, I was a practicing veterinarian. So I graduated from Auburn University, started practicing in Virginia for a year, and then moved slowly back to Kentucky to my sort of the hometown where I grew up. And my story is I grew up on a farm, so I always thought I wanted to be a veterinarian, and worked really hard through undergrad and vet school, and thought, when I'm finally graduated, this is going to be awesome. And my first year out of vet school was a really bad situation. So bad job, no mentor, a lot of things that were promised didn't happen, and I actually almost left the profession. And I stuck it out there for a year and then moved on. But what that instilled in me was like this desire to make things better for the next generation. So when I'm not making cat videos and practicing vet med, what I'm really passionate about is mentorship and like fostering the future leaders of our profession. So that's what really gets me excited. So I kind of did that for a long time, and that's what I'm doing in my new role, is focusing on that. Yeah.
2 things. 1, I would have never guessed you grew up on a farm. What type of animals did you have on a farm? Because when I see Cat Biscuit making videos, and your cats live a plush life. It is not what I would as they sunbathe behind you. not exactly what I would have expected. What kind of animals did you have on the farm?
So it was mostly a produce farm. So I spent my summers picking apples and tomatoes and corn and all this type of thing. We did have some cattle on there, but not a whole lot, and no horses or anything like that. So lots of dogs and cats running around on the farm. So that's always what I was most interested in, was dogs and cats, even from a young age.
That is so cool. The second thing for, this is very meant for anyone who loves animals, pet parents, but obviously we'll have some veterinarians listen. I think what's really important to point out is you said after your first job, you almost left, but then you found your path. Like you found what you're passionate about. You're still in the profession several years later and you love it. And I do think that's really important to point out because there can be with any profession situations that aren't the right thing, but that doesn't mean the whole profession's not meant for you. You just might need to change your trajectory. So I think that's a really important thing to point out because I would have never guessed for someone who, when I watch your content, when I talk to you at conferences, seems so passionate about the field to hear you say almost left it. It was a little shocking. So I think that's a really, really important thing just to point out.
Yeah, thanks. I was kind of at that crossroads, and when I when I mentioned to my wife that I might have made a mistake and wanted to do something different, she was like,
Yeah.
"I'm going to kill you." What? We just went like 8 years? What? Like you work for like a week and now you're ready to quit? But yeah, it's I think I kind of thought I can either just leave and move on and forget about all that, or for my whole life I thought I wanted to be a vet, and I was like, well, I guess there's an opportunity to make things better. And what I really have realized over the past 4 or 5 years, and you know, there's a lot of bad stuff with social media, but one of the good things is the ability to connect with so many people that are passionate. Because 20 years ago you're sort of siloed. So if you're in a really negative practice or something like that with bad culture, you just feel trapped. And these days I can connect with people like you and people like Adam who can really like, yeah, we're excited about this. This is a great career. We're doing amazing work every day. And so that's been huge for me.
Love that. And speaking of social media, you are connected and you found such a great group of individuals around the world that just really enjoy the love of cats. And that I want to thank you for doing that, honestly, as a veterinarian, because you're really bringing it front and center, taking away maybe some stigmas that you hear out there about, cat parents and so forth. But you really are building such a great community of humor, laughter, and education. So tell us a little bit about what you got involved on doing that on social media.
Yeah. So like when I first started, and the social media thing was never a plan, it was just sort of like an accident that happened organically. So during during the pandemic, working curbside in my office, my daughters were doing homeschooling because their schools were shut down and all that, and they were obsessed with TikTok and Instagram, obviously. So they created a TikTok account for me. I started just like making videos in the
Just
office, and
like
the
they
goal of that
started it
initially
for
was,
you? Your daughter
yeah,
started it.
my daughter
You
started it.
better give
She's like, I'm
them
getting
the
really TikTok.
royalties.
Yeah. I know. She's always, trust me, she's always asking for money.
How old are they?
Um, right now, my daughters are 18 and 15.
Oh, yeah, prime money
Yeah,
asking time.
Yeah.
exactly. Yeah. So initially, we were doing more like clinic centered videos. Trying to show clients that curbside wasn't scary, that their pets were in good hands. We were taking great care of them. Kind of a trust building thing. And then um, and I probably had more dog content than cats initially, just because I was seeing more dog patients. And then my daughter had been begging for a kitten forever, my youngest daughter, the one who started the TikTok for me. And this little special needs kitten came in during curbside that was obviously going to need like a lot of specialized care. And I don't know what it was about me that day. I was feeling soft or not very smart, but I was like, oh, I'll take this kitten. So that was RuPaul. She's the one sleeping there in a little ball behind me. But I gave her to my daughter for her birthday. And, I really saw how this cat, like, I credit her with like getting my family through COVID, like just this human animal bond, kind of this newfound like appreciation for like the joy that pets can bring into our lives. And she's just like super hilarious personality. And she's the one that started doing the biscuits and all that. So then her videos blew up, and really she's the one who's famous on social media, not me.
That is awesome. So RuPaul, did she come with the name or was that a given name?
No, my daughters were obsessed with RuPaul's Drag Race during COVID as well. So
Amazing.
we rescued lots of drag queen kittens with different drag queen names. She was the first. So
Adam, do you
I
think he
love
has
it.
like the most fun house?
Yeah, definitely. Because I tune into his live streams and they're hilarious,
Oh
and
my gosh.
you have RuPaul outside on the grass too, doing her thing.
yeah.
You really showcase like animals don't know those differences. And now you have a newer kitten. Tell us about the one that has cerebellar hypoplasia. And to the cat owners that may not know, what is that?
Yeah, so our we have three special need cats, but our newest one, so funny story, I thought our house was crazy enough and our hands were full with everything else. And I was in London for work and my wife called one night and she's like, "Oh, by the way, we're getting a wobbly kitten." And I was like, "Oh, okay." I think she just made that decision. So the day I got back, we went and picked up this cerebellar hypoplasia kitten. And what that is basically, your cerebellum is the part of your brain that's responsible for like balance and fine motor movement. So it serves a pretty important function. And it's the thing that happens with cats if they're exposed to a certain virus or other developmental issues when they're in utero, but they're born with an underdeveloped cerebellum. So she has trouble getting around. People call them wobbly kittens because they kind of have these, intention tremors all the time. And hers is pretty severe. I'm not sure she's going to be able to walk yet, but she is just having her best life right now. She's eating great. We put her in the litter box. She does her thing. And, my family just is in love with her. So it's been pretty cool.
It's all that matters.
Yeah.
Every day is a good day to them, really.
And then what's
Oh,
the
yeah.
second cat you mentioned? Oh, sorry.
No, you're good. So the tabby on behind me is RuPaul, and then the one in the little circular bed there, that's Rushy. So she's from Dubai. So she was hit by a car on the streets of Dubai, and if you've seen any of my videos of her, like this rescue group in Dubai sent me videos of this cat that was just dragging her back legs around on the streets, and they took her in. And they were like, "Hey, you have this other special needs cat. Do you think you could maybe help us find a home for this cat?" So we had this cat, Rushy, shipped from Dubai, and then she just ended up staying with us because we liked her so much. So
Wow, what an exotic
yeah,
household you have. And what's the dynamic between
yeah,
the three cats, all having very different special needs? I mean, your videos look like, there's a lot of friendship and harmony and joy there, but is there like someone who really rules the roost? How does that go?
yeah. I would say RuPaul's definitely the boss. She's also like the mom, so it's really sweet. We can bring in any cat off the street and she like takes over as like its mom and cleans it and is super sweet to it. And Rushy is a little bit more standoffish, but there's no fighting or anything like that. They're used to that. That's normal for them. There's cats coming and going. So, and we have a fourth cat too that actually has all of her legs and everything, and she's hiding upstairs right now. She's not as social as the rest, but yeah, they all get along fine.
That's
So one
awesome.
normal cat,
Yeah,
quote
that's
unquote
Trixie
normal.
Mattel. Yes.
That's
And
awesome.
what about as a veterinarian? There's a lot of myths that sometimes happens. When we're talking about preventative medicine. Like indoor cats don't need vaccinations. What are your thoughts to the cat parents that are tuning in about that when you hear that?
Yeah. I practiced for 20 years, so I had these conversations a lot with people, and I definitely understand that, people are always worried about, I don't want to give my cat something that, it doesn't need. But what I would always tell my pet parents is I saw at least 50% of the cat cases that I saw that came in with fleas were quote unquote indoor cats, right? So it's so easy for the outside to come in, through a screen door, or just one flea hanging on your sock when you walk in the door, it jumps on your cat, and you know how it is. They have hundreds of babies within a few weeks, and then pretty soon you have a flea infestation. And the same thing about vaccinations. I've seen horror stories. I had a personal story where this family, they had an indoor cat, so they didn't bring it to the vet for like 6 or 7 years, and a bat got into their house, and they came downstairs and the kids were playing with the bat and the cat was playing with the bat. And so, obviously, just to be safe, they had the health department submitted this bat, and it was positive for rabies.
That is
So
Oh,
terrifying.
yeah. So now
right.
you have, yeah. So now you have kids exposed, cat exposed, all these, issues. So sometimes, in how many situations do you see every day on your next door app or whatever where somebody's cat got out? So just because your cat's inside doesn't mean they're not going to get out and get exposed to something.
Yeah.
Right.
Thank you for my next nightmare. I am not a big bat person. I was in a restaurant, like a pizza restaurant once, like years ago, in downtown Minneapolis, like a big city, and somehow a bat ended up
Oh
like
no.
flying around the restaurant. So you're totally right. I mean, there, n- it's not a force field. As a dermatologist, exactly what you said. I talk about like fleas all the time, and I'd say predominantly I see mostly indoor cats for flea allergy, and it's because and I do understand, like I do get it. I get the mentality, but they're inside, maybe their risk is less. But doors open, windows open, things happen. You're right, cats get out. And the things that we're talking about being preventative of are scary things, right? Like, I've seen when I used to work ER, this is extreme, but I saw a young cat come in totally anemic from being infested with fleas. And it had gotten out from the house. It was an owned cat. It gotten out from the house for like a week. They couldn't find it. They find it. It's very lethargic, totally anemic from being flea infested. So these
Oh
things
yeah,
happen.
for
And the
sure.
problem is, right?
People
Like they
think
are
it's just
preventative.
gross. And
Yes.
And I know that, we talk about the human animal bond, and it's so special with cats, and I think we as veterinarians, when we're sending them home with medications for whatever reason it is, if it's overactive thyroid or allergies, what are some things that we can do to help minimize the stress of owners trying to administer medications to their cats?
Yeah, I think, as a veterinarian who practiced for 20 years, that was my biggest struggle with like chronic issues with cats is medicating cats. And, we always talk about compliance, and you can prescribe a perfect treatment for a cat, to address the problem that they have. But if that medication doesn't end up in the cat, it's not going to be effective. And then the other thing is, and there's not just that, but then dogs are easy usually. You can hide a pill in almost anything, and most dogs will fall for it, right? But cats aren't that way, and we know how it is when you get your cat really stressed out about something. So trying to like force a pill down your cat's throat, that really is something where your cat, instead of your cat that loves you to pet it and you spend time together, now it's running away from you because it doesn't want you doing this horrible thing to it every day. So that really can affect the human animal bond. So I think it's really important to come up with ways to make medicating the cat as painless as possible for the owner. And there's different formulations we can use and things like that for sure that can help.
And can I add on to that? Because I do want to make sure we talk about compounding because it's super important. We also need to ask, and as a pet parent, please don't be afraid to tell your veterinarian what has worked. So many times I
Exactly.
see people assume. So, as a dermatologist, I have to chronically medicate cats all the time, and there are not a lot of reasonable injectable options. There's just not.
Yeah.
Steroids are great if you just need them like once, twice a year, but if you're chronically on it, it's not great. So I always ask owners, but I've seen before where owners are like afraid, like if I assume they would do better on a liquid, um, they'll be like, well, actually they do great with tablets. They hate liquid. So as a pet parent, politely, but you want to be an advocate for your cat. And especially if they have been through medications before, what's helpful, what works. Like, do not be afraid to tell that to your veterinarian because I would much rather have someone tell me, we're going to start an oral medication, we're going to compound it. Either if there's a flavor they like, or if they're like, actually, they do much better if we do a capsule form of it. It's much easier for me to know rather than just assume and then find out that we're just not successful. And to your point, I think it's really important to think about the cat and what that is going to do to the relationship with the pet owner. Sometimes a lot of cat owners are like, well, I can force it down them. I'm like, well, do you want to force it down them for 10 years? Because
Right.
eventually
Yeah.
they're smart. They learn very quickly that you do that thing every morning. I see you going to the cupboard. I don't want that thing. And then all of a sudden they're
Yeah.
out of there and they will hide, they will go away. And to your point, if we can't consistently give it, we're not going to manage them well.
Yeah, absolutely. I think what you said about being the advocate for your pets when you come in is so important. And really, that's a lot what Adam does on his site is just empowering pet parents to like speak up and, think about your vet as your partner in managing this. Like we're on the same team as you. We want exactly what you want, which is the best possible life for your pet. So for sure, like, and I think about things a lot of times as a pet parent versus a vet and try and look at both sides. Like, our cat Rushy just had a bunch of teeth extracted this week. So not treating my own pets now has been kind of weird, when I have to take them to the vet and bring them home and like be like a pet parent in that situation. But I had to get this tablet into her 3 days in a row after she had 9 teeth extracted. Like, that was not fun.
Oh, no.
Oh my gosh. And to the cat parents tuning in, when you hear the word compounding medication, I always like to say you're thinking of customizable medication. So when you hear compound, think of customizable. So that's why what Ashley was just talking about, can you tell me what you prefer? What does your cat prefer? Because we really can turn almost anything into anything. So it's a matter of having a conversation. And these are pharmacists that we as veterinarians talk to prescribe that medication, whether it comes to our hospital or it goes to your home. I know, like I said, me personally, Wedgewood Pharmacy has been really instrumental because not only just great customer service, but they really have so many different formulations that are out there. And Matt, if I ask you a word, can you tell the cat parents what that is when we're referencing this? And Ashley, as a dermatologist, I'm sure you know what we're talking about. So if I say something like transdermal, what does that mean to the cat parents?
Yeah, so this is huge for cat parents because transdermal is a medication that instead of having to force it in the mouth or inject it, you can actually rub it on the skin and it's absorbed that way. So I had so many clients, elderly clients that had this 17 or 18-year-old cat that was like literally their best friend and the only thing keeping them going every day. And they're diagnosed with hyperthyroid disease. And the thought of them having to give their cat a pill, twice a day with arthritis in their hands and those types of things. It was just really, really difficult. So probably the most common transdermal that we used in our practice was transdermal methimazole, which is for hyperthyroid disease, where that client could easily just rub that on the inside of the cat's ear once or twice a day, and that will be a much more effective option for them.
And Ashley, as a
Yep.
dermatologist, curious to just get your take because you see something called atopy in cats, which is like chronic allergies. So, what does that look like to you when you have to prescribe long term medication?
Yeah, what I love working with compounding pharmacies for, because I will say cats are by far probably the most common thing we compound for because of one limitations. There's just not as much available for them, especially with allergy management compared to what I have available for dogs. They're just very complicated with their allergies. There's a lot of different presentations. A cat with allergies to the environment could come in because they're over grooming their belly. They can come in because they have a mass in their mouth called an eosinophilic granuloma. They can have asthma. So cats just really like to be quite complicated and not direct with their allergies. So we don't have as many options for them. So, there are some limitations. And what I love working with reputable compounding pharmacies, as you mentioned, they're trained. This is what they do. They know the ins and outs of these medications. Is to also let us know, what's realistic and what's not. Can I compound it to this concentration? What medications maybe are not as good to use topically. So, for example, cyclosporin is a medication that we utilize for allergies orally, but you can't really make that into a topical. So, you want someone who's really knowledgeable about those things, which I really appreciate in reputable pharmacies like Wedgewood. For me, honestly, it's a lot of oral medications and it's using a lot of different one, asking the pet owner what has been successful or what has not been successful in the past. Let's not waste the time and money on the things that have not worked. Let's try something different. Also, just telling them we might have to try a couple of things because every cat is an individual and they do lay the law of the land. Like if they're not going to take something, I don't care how good you are about giving cat medication, they're probably not going to take it. So for me, a lot of it is, working with, we're going to do something like, the tiny tabs that can kind of dissolve in their mouth very quickly, which is a great option, or utilizing something like liquids, but really working with the pharmacist on flavoring. That is huge for me. A lot of times I ask cat owners if we're going to compound a liquid, one, I talk to the pharmacist about what is realistic for that concentration. So we could try to give less volume if possible. Two, what flavors do they find successful, either the pet owner or talking to the pharmacist? When I'm doing things like diet trials, I have to be really cautious
Yeah.
because I can't use things like chicken flavoring, fish flavoring. But a lot of times we can use non-protein things like, marshmallow is something that we have been able to utilize in the past, some malt flavors. So they'll kind of have options too, where we say we have to have non-protein sources while we're doing this diet trial and then we can work with them. And I'll set up owners to say we might have to try a few different flavors. Like I've had the most random stuff where I have a cat right now, I kid you not, wouldn't take like triple fish flavor, whatever that is, lots of fish, chicken flavor, because it's not a food allergy cat, strawberry. Cat loves it. Cat loves
Wow,
it. I'm like, okay.
unbelievable.
Isn't that weird?
Yeah.
Cats.
Matt, in your experience, what do you find cats tolerate the most? And if, like Ashley was just talking about liquids, allergies aside, what do you think they go most for?
As far as medications,
Yeah, like what flavor of medication do you think? I know the answer,
um,
what I hear, but I'm curious to see what
yeah, I would say like in general, I've had the most luck with like the fishy type flavors or a chicken flavor. And sometimes I think it's because you can like mask it easier in like treat or soft food as well.
Yeah, interesting. Yeah, usually it's chicken marshmallow, I believe, right, Mash? I think that's like the
Marshmallow, for whatever reason, you never would think a cat would eat a marshmallow, but yeah, I've heard that as well.
So
yeah,
when you were telling me about that earlier, I was kind of like, what? Like, why would you put the two together? And again, this is why you work with people who know what they're doing, right? Because I would have never thought, like, let's use chicken and marshmallow together. That sounds awful to me. But, again, pharmacists who have experience and this is their job were mentioning the marshmallow kind of cuts out the medication flavor so that they can really taste the chicken, right? I guess it's like, being a really good chef for cats. Like you can kind of say, well, this cancels out this. Like, when you go to a restaurant and you're like, that sounds weird. And then you eat it and you're like, oh, that's amazing. I guess that's kind of the beauty of working with someone who actually has experience in this type of stuff.
right. I love it.
Yeah.
So we talked about making indoor cats. We talked about their wellness care. We talked about compounding, and as we're wrapping up, I think it's important to talk about some of the behavioral things too. And Matt, you're really good about like talking about these things and addressing their wants and their needs. I mean, those of you that are watching this on video and you see that he's got this incredible. It really is like MTV Cribs for cats.
I
Really,
know. That is like
Right.
all the cats
This is
watching
my
this
office.
is gonna be jealous. This is your
Yeah.
office?
Yeah.
yeah. It's unbelievable. But stress to the listeners the importance of behavior, understanding their wants and their needs, trees, looking out, being simulated. What does that look like to them?
Yeah, I mean, especially for indoor cats. I mean, I think you have to. The biggest, just to start off, the biggest complaint that you see as a veterinarian is the urinary issues. And there's some things that you definitely need to follow up with your vet to see if there's something else going on. But there's a lot of real easy fixes that people don't even do at home. And the number one rule I would say is you need one litter box per cat plus one, right? So I have 4 cats, I'm going to have at least 5 litter boxes, right? And especially these days, no one wants litter boxes everywhere in their house. But these days, they have really like fancy, stylish litter boxes that just look like a little cabinet or like a table or something like that. So there's things you can do, and then also certain cats like different substrates for litter too. So if you figure out that your cat likes this and not that, you're really going to minimize those issues of having accidents outside of the box, right? So that's a huge one. The other thing is they just like to be stimulated. So they're hunters. They like to feel like they're hunting birds and all that. So we have these windows here, and I'm just full of bird feeders out here. So they like to perch up high. Now, mine with mobility issues can't get as high as some cats, but they like to feel like they're up high, looking out the window, watching the birds, those types of things. And then I think a lot of times, just like giving them a little bit of extra enrichment, like I'll just rearrange some things out here. So if I if everything's been like this for a week and then like I come out one day when they're not in here and I just move the cat tree to a different spot and a bed here, like they love it. You'll see them in here just exploring for like 2 hours, figuring things out. So different things like that to enrich them.
That is the most simple thing I've never I'm gonna be totally honest. I'm always learning. That's why I love doing the podcast. I always learn stuff. I have never thought of the simplest thing as just like move what you have. I never have. Like
Yeah,
I've
you just
always been
move
like,
things
get a new
around.
toy, get this. That is so simple.
Yeah, yeah. They're very observant. So any changes in the room, they're immediately fascinated and they want to check it out. And
Can I ask one other question? Because I think this is super
yeah,
important for cat pet parents. And I know some of the tricks I use, but I'd love to get your intake. How can we make it less scary for cat owners to get to the veterinarian? We, as veterinarians, have
yeah,
all had the last second cancellation because they can't get the cat in the carrier. And I think it's really easy if you have, say, a younger cat or a cat who hasn't had health issues to not worry about it. If they're only going in once a year, or if you just kind of have the mentality of, well, they don't really go to the vet that often, but then they become hyperthyroid. They become older. No one expects a medical issue, I guess, unless you're Matt McGlasson and accept them as special need cats from the get go. But no one anticipates that for the most part. So, what can we proactively have cat owners do to make it so we are not such a scary place when they are bringing their cats in?
I think a big one that's super easy is leaving whatever you're going to transport them to the vet in. And I have some thoughts on that as well, but invest in a good carrier
Can you
and leave
describe
it
what
out.
that looks like? Because I think this is
Uh,
super important.
I wish I had it in here to show you. So there's a company. I'm not getting paid for this or anything, but there's a company called Travel Cat, and they make amazing, like, that's all they do is make backpacks and carrying options for cats. So those are the ones I use. They have hard-sided ones and more soft-sided ones, but you want something that, like, you see the old school carriers where you have to open the little cage in the front and reach in and like rip the cat out. So these are carriers where you can open the top, you can open different spots. So like a lot of times in the vet, if I had a really nervous cat, I could just open the top of the carrier and just reach in that way. And sometimes you can do your whole exam with them in the carrier, not having to snatch them out and all those types of things. So just thinking about things like that, making it easier to access the cat, but also so they feel like they're safe and secure. And leaving it out in your house all the time, so it's just a normal part of their everyday environment, is huge. Like, I'll just catch my cats; they just go in there and take a nap or hide or whatever. So a lot of times, once a year, the cat parent goes into the garage and pulls out this cat carrier that's been in there for 11 months and it's covered in cobwebs. And I've seen cockroaches and everything in there. So, the cat knows when I see this, bad things are going to happen, right? But if you just keep it as part of their normal activity, it's not so scary. And then the other thing is, there are a lot of cats that are going to get really, really nervous going to the vet, even if you do everything right. Don't be afraid to like talk with your vet about that and see if you should be maybe pre-medicating your cat with something. So there are a lot of cats out there that just going to the vet with a little bit of gabapentin on board makes things so much more pleasant for the cat and the cat parent and the vet staff.
And I think there is a bit of a stigma on that too. Like all the things you mentioned, I'm just like sitting here nodding. So I'm like, yes, yes, preach it, preach it. Cause it's so important. Please do not get a cat carrier you cannot open from the top. Please do not zip tie them down.
Oh,
It's feline friendly. And if you have a really nervous cat, you can look up fear free and feline friendly practices. But it is so
Mhm.
terrifying for an animal that is in a cage and clung to the backside because they don't want you out. One, it's not safe for the owner or for the veterinarian if they have to pull them out like that, because you never know when they could just get intimidated and react on it. And none of us want that. And it is also just more scary for them versus I love being able to take the top off. I'll just take the top off and
Yeah.
like you said, and examine them in that carrier. Use pheromone products. It's pretty amazing. We have pheromone diffusers for dogs and cats in all of our exam rooms, but really nervous cats, I'll have owners spray the pheromones like in the carrier before, or
Yeah.
they'll put a towel over the carrier, safely. It's ideal actually either to have a cool travel cabinet, look that up, backpack like that you can carry them around in, or hold the carrier from the bottom. Because if you're doing the handle and they're like swinging like this,
Yeah.
that's really scary for cats. And being able to lift the top off is super important. And the last thing, yes, for sure, talk to the veterinarian about pre-visit pharmaceuticals. It really can, my dog goes on pre-visit pharmaceutical when she goes to see her veterinarian. It just takes the edge off. It's safer not just for the veterinarian. It makes the exam quicker because she's just less anxious and not hiding under me the whole time. But it also just takes the edge off for my dog who is nervous in that situation. And I think sometimes owners think, oh, well, I have the pet, it has to be pre medicated. I mean, honestly, a lot of our patients probably should be pre medicated because we are scary and we can't explain to them what's going on. But I love everything you mentioned and having the carry out all the time. Yes, please. We just should not be taking these scary things out. It should just be out as part of their norm and they just don't even know when vet day is happening. So I think all of that is so amazing.
well, this has been fantastic, Dr. Matt McGlasson. Where can we learn more about you, my friend?
You can find me at
And that's a wrap,
Dr. Matt
everybody.
McGlasson.
I'm just,
What did you say, Adam?
I go, that's a wrap. We're good. I'm just kidding.
This guy.
Man, I love him so much. Go ahead. Where can we learn more?
Yeah, at Dr. Matt McGlasson. So it's dr.matt McGlasson. Same handle on Instagram, TikTok, and Facebook.
Excellent.
And most
Awesome.
importantly, where we find RuPaul, Rushy, and what is the official Wobbly Kitty's name? I know you have a pretty extended name.
Princess Baby Nugget Wobbles the first.
And then the normal cat that doesn't show up because they're so nervous. So most importantly, that's
Yeah.
where you can find amazing, funny, entertaining content with those kitties.
So wait, okay. So can we just
Right.
reenact that again? So if I have to, the kitten's coming in for a visit, I look at my file and I go into the waiting room and I call.
Princess Baby Nugget Wobbles the first.
I love that's the first.
I love
Who
it.
named the cat?
He's a big deal. It was a group effort, but ultimately I took a lot of ideas from my family and came up with that. I thought she deserved a big name.
Yeah, definitely.
Love it.
Big
What's the
personality.
nickname? If you're just like, "Bruh," like,
Either Nugget or Baby
love it. So
Cute.
or
sweet.
Princess. All the rest. She's a lot. Yeah.
Love
Well,
it.
this has been a pleasure. I mean, we knew this would be just so much fun, so much entertainment. Adam, any last words?
Yeah, and to the cat parents out there, if you want to learn more about compounding, how to administer these medications, and learn more, please visit wedgewood.com. They have educational videos for you all just to watch, very simple ones on how to get medications, what compounded medication is, and what to chat with your veterinarian about that. So check them out again at wedgewood.com.
And finally, again, thank you to Wedgewood for sponsoring this episode, but also just having that educational content out there for our pet parents. And thank you to these two fellows right here, Dr. Adam Chrisman, Dr. Matt McGlasson. Always a pleasure. And I can't wait for pet parents to hear this content.